Now, access to clean water and safe sanitation are top global health priorities. As Kenya strives to ensure equitable and universal access to this precious commodity by 2030, the demand remains high in the arid and semi-arid regions like Narok County. Our reporter Gloria Milimu was in Narok County and filed the following report on how the availability of water, sanitation and hygiene facilities is helping transform the life of members of Oldonyo Orasha village in Narok South Sub-County.
It is one of the most important natural resources. Yet, it remains at the core of sustainable development. At the human level, water cannot be separated from sanitation. In many ways, public health experts say this precious commodity plays a critical role in the reduction of disease burden, improving health, economy, and even education. However, many are still grappling with water scarcity, a situation that affects at least 2.2 billion people globally who still lack access to safe drinking water. For school-going children, availability of water and good sanitation cannot be overlooked. It is indeed argued that quality education requires a healthy, enabling environment for students. In other words, water is just as essential as books in schools. In schools like Oldonyo Orasha Primary in Narok South Sub-County, improved access to clean water and sanitation facilities continue to create a conducive and enabling learning environment for these pupils who initially lacked the facilities. Access to water, hygiene and sanitation in schools or WINS is the right of every child. But for this community, this right remained just on paper until 2 years ago when the school's water shortage was addressed.
After rehabilitation of this borehole, we got clean water.
Experts say safe drinking water, basic sanitation and proper hand hygiene are essential for the health of children. So much so that child health experts warn that in the absence of water, children become prone to diseases and infections. When they cannot wash their hands, they become susceptible to diarrheal disease and other infections that force them to miss school.
We used to have these waterborne diseases due to this contaminated water. But nowadays, at least it has improved.
This was the same case for the 335 pupils in Oldonyo Orasha School. According to the school's head teacher, Samuel Kewa, they now have access to clean water, functional toilets and bathrooms. Above all, they practice proper hand washing techniques.
Children who have such facilities are able to attend school and they are able to transition from class to class and they are able to transition to high school and even to university. So it's an opportunity for all of us to give children an opportunity to go to school and pursue their dreams.
Similarly, the availability of water has also facilitated the need to equip the learners with knowledge on climate change and its effects, and how tree planting can help improve the environment and create a conducive learning space for them. Drilling and rehabilitation of boreholes in 6 schools in the county played a key role in improving access to water. At least 2,452 pupils in 6 schools in the county can now enjoy safe water and sanitation and hygiene facilities, according to experts. Access to quality healthcare and clean water, sanitation and hygiene services, or WASH, are basic human rights, according to the Constitution of Kenya. It also aligns with the United Nations Sustainable Development Goal number 6 that calls for availability and management of water and sanitation for all. Currently, the world is grappling with adverse effects of climate change, And Kenya is not spared. But its impact on the arid and semi-arid lands like in Oldonyo Orasha in Narok South Sub-County has been severe. It has strained the limited natural resources.
Ukioga na hiyo maji ni ya chumvi. Hata ngozi naye ukioga unakutikana unaangaliwa wewe ulikuwa mweupe, umekuwa saa zingine vitu zinatoka kwa ngozi.
In areas like this in Narok County, it is not uncommon for women and girls to spend up to 2 hours in search of a safe source of water.
Tulikuwa naenda kuleta hiyo maji kwa mbali. Tunabeba kama mtungi 2 ama 3. Juu tunapeleka funda, kuleta na funda. Hiyo maji kuna wakati utakaa mpaka kuwe green. Na bado tunatumia utapika tu alafu tukunywe. Tutawasha naye nguo.
Rehabilitation of boreholes at Oldonyo Orasha Primary School has facilitated the availability of clean water for the residents too. According to engineers, the water system spans 2 kilometers, linking to a 50,000-liter reservoir tank. This distributes water to 3 water kiosks where the residents can easily access it for their use. Their animals also quench their thirst at these kiosks that are fitted with watering troughs.
This is a solarized borehole of a 7.5 kilowatt system with a bowl capacity of 10,000 liters per hour. By estimation, this is going to serve close to over 7,000 people.
Availability of safe and clean water, according to the county's WASH coordinator, has helped in taming public health threats that emanate from consumption of contaminated water, especially in the sub-county.
Initially, we had a large number of pupils being tended to in terms of fecal-oral infections, but of late we've seen a quite reduction of numbers of those whom we are receiving at the health facilities.
Whereas this natural resource is helping transform the health outcomes of residents here, the major challenge now remains appropriate disposal of human waste to avert environmental contamination in the sub-county. Out of the 2,800 villages in Narok County, at least 780 have been declared open defecation-free zones. However, in Narok South Sub-County, where Oldonyo Orasha village is, the toilet coverage, according to the local leaders, is only 30%. According to the Kenya Demographic Health Survey report of 2022, open defecation is practiced by 7% of the population. Currently, 80% of households in the country have improved source of drinking water. This percentage is higher in the urban areas compared to the rural areas at 94 and 71% respectively. The report further says at least 51% of the population has access to basic hand-washing facilities. Even as Kenya strives to achieve Sustainable Development Goal number 6 that calls for universal access to safe water, dignified sanitation and hygiene for all by 2030, experts advised the need for the government to continuously improve access to healthcare and WASH through robust investment to fully meet the goal. Gloria Milemu, KTN News.
Thank you, Gloria, for that report. And it is on that note that Weekend Prime comes to a close. My name is Dennis Aseto. Our sign language interpreter is Merisha Owito. To the entire team that made this a success, asante sana. Enjoy the rest of your viewing and enjoy the rest of your weekend. Good night.